Craig Stevens here, Spokane Sports and Physical Therapy. Physical therapist now for 27 years. We've already covered one video on knee pain caused by the patellofemoral joint. Now we're going to talk about knee pain caused by the Pes Anserinus bursa. Okay? Basically, the inside of the knee, we have the medial collateral ligament, but we also have several tendons in here, 3 to be exact, and a bursa. Okay? Now, this bursa in here gets pinched, gets swollen. In this young man's case, it got scarred down because of chronic ACL laxity. The knee was constantly sliding forward, sliding forward, sliding forward, and that was causing trauma. So fibrosis built up in there, and so did the bursa. The bursa got stuck. So when they went in there and did a hamstring repair on his ACL, we still had the scar tissue in this area, so this area wasn't allowing the knee to move freely. Now, this doesn't just happen in ACL reconstructions, it happens in everyone. 83-year-old ladies who've got osteoarthritis of the knee, we see a lot of Pes Anserinus bursitis causing pain. It doesn't mean they don't have osteoarthritis, but the knee pain is actually caused by the bursa being swollen. Okay? So, I was given a question last week by a patient. In this area, because of COVID, there's been a lot of talk of, we can't do surgeries right now. What do we do with our pain? Well, if you have osteoarthritis of the knee and you have a lot of medial or inside knee pain, we need to look at the Pes Anserinus bursa. Now, I can't fix the osteoarthritis, but I can certainly get rid of the bursitis. So that's one of the areas that if we can reduce the swelling in, pain goes down. Pain goes down, knee functions better, people are happy. So the Pes Anserinus bursa, to think about a bursa, I tell my patients, the bursa is like a deflated balloon. What it does is it reduces friction. When there's too much friction, we get heat, then we get swelling, the bursa swells up. When the bursa swells up, it pushes on the tendons, pushes on the muscle, and now we have pain when we try to move, we try to straighten it, we get out of the chair, it wants to bite and it hurts. And again, it looks like an MCL or medial collateral ligament pain, but it's actually bursitis. Now, I have seen a lot of Pes Anserinus bursitis or Pes Anserinus injuries with MCL injuries. That's pretty common too. So you can have an MCL injury and a Pes Anserinus bursa, or a Pes Anserinus injury. So we can help with the Pes Anserinus bursitis if that's the problem. So if you push on your knee and you feel like, oh man, that is really tender, the MCL is deep, deep, deep. You got to push hard to get to the MCL. You probably have some component of bursitis. First thing I tell my patients to do at home is obviously ice. 80% of patients can ice. 20% have a problem with it. So if ice is not good for you, or you don't like it, or you get an allergic reaction, don't ice. Put a warm compress or a hot pack on there for no more than 15 minutes. That will help with some of the swelling, but ice works the best. Other than that, reducing your activity is the only other way to reduce the bursitis. If you can't get those things done with usually in about 7 to 10 days, it's time to see someone to address your Pes Anserinus bursitis. So, Pes Anserine bursitis right there. Yeah, people don't like that when I work on it, but if we get the fluid out of there, they feel better. All right, Craig Stevens, peace out. Fingers getting better but not healed. Love you guys. Thanks, Quân.